Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Lumbar plexus. So lumbar plexus is formed by the divisions of the first 4 lumbar nerves. So division of the first 4 lumbar nerves. So this includes the L1 to the L4, and from the contributions of the subcostal nerves, and this includes the T12, and which is the large thoracic nerve. So the following we are going to look at the nerves, the root values and the innervated muscles as well as the cutaneous branches. So the first is the iliohypogastric. So iliohypogastric, the root value includes the T12 to the L1. So what is the innervated muscles? Innervated muscles, it includes the transverse abdominis as well as the abdominal internal oblique. Then comes the cutaneous branches. The cutaneous branches, it includes anterior cutaneous ramus. So it is also known as the ACR, anterior cutaneous ramus, and also the lateral cutaneous ramus. Now we look at the ilioinguinal. The ilioinguinal root value, it includes nothing but the L1. So iliohypogastric is H12, the T12 to the L1. So ilioinguinal is just the L1. So the innervation is similar, that is transverse abdominis as well as the abdominal internal oblique. And the cutaneous branches, it includes the anterior scrotal nerves, and this is in case of the males, and also the anterior labial nerves, and this is in the females. Anterior labial nerves, and this is present in case of the females. Now we look at the GF, that is the genital femoral. Genital femoral, the root values include the L1 as well as the L2. The innervated muscle, it includes the cremaster, and this is present in case of the males. And the cutaneous branches, it includes the femoral branches as well as the genital ramus. Next is the lateral cutaneous nerve of the thigh. So here in the lateral cutaneous nerve of the thigh, it includes the L2 and the L3, and this innervates the lateral femoral cutaneous. So this is nothing but the cutaneous branch is the lateral femoral cutaneous. Next is the obturator. The obturator is from the L2, L3 as well as the L4. So the muscles innervated, it includes the obturator externus, the adductor, there is a adductor longus, there is adductor brevis, there is presence of gracilis, there is presence of pectineus as well as the adductor magnus. So the cutaneous branch, it includes the cutaneous ramus is what it supplies. Next is the femoral. The femoral, it includes the L2, L3 and the L4. And the muscle supplying, it includes the iliacus, it includes the pectineus as well as the sartorius and the quadriceps femoris. So this is nothing but the femoral, L2, L3 and the L4. So what are the cutaneous branches? It includes the anterior cutaneous branches as well as the presence of the saphenous. Next is the segmental branches. The segmental branches, it includes the T12 to the L4. So T12 as well as the L4. So the muscles involved is the psoas major. So psoas major muscles and as well as the QL, that is a quadratus lumborum. To learn and grow daily like this, please do subscribe.